of Medical Anthropology, the Director of Medical Humanities Program at the Wits Institute for Social and Economic Research, also known as WISER. So let me begin by introducing our keynote speaker, Dr. Ela Manga. We're excited to have Dr. Ela Manga, who is a renowned integrated medical doctor and author. Dr. Manga is the founder of Breath Africa, an organization that promotes the use of breathwork for transformation at all levels of society. Her first book is titled Breathe, and the second book titled Through the Lens of Breath. She collaborates with photographer Simon Kiharis. She has also written an ebook titled Burnout to Breathing, which can be downloaded from her website, drelamanga.com. She has a podcast series called Threads of Healing, where she's in conversation with sages, medical doctors, artists, storytellers, entrepreneurs, journalists, activists, and visionaries. The different episodes are available on her website. On behalf of the Breath team, I would like to welcome Dr. Ela Manga and everyone who's joined us today. The format of the session is that Dr. Manga will speak for about 30 to 40 minutes, and we'll have the discussant Carlos Sampiris, who is a senior lecturer based at the Primary Health Directorate at the University of Cape Town. I will then open it up. During the talk, we encourage you to put some of your questions on the chat, and we'll draw from here and also from the audience. Over to you, Dr. Manga.
Wazi, thank you so much for that wonderful introduction. It is such an honor for me to be part of this incredible symposium. I think 2020 will surely go down in history as the year of the breath. The year that a global pandemic catalyzed a global consciousness of what it means to breathe, to live, to die, to be human, to be vulnerable, to be creative. And just as we entered the decade and wildfires choked the planet from California to the outback, a microscopic virus brought the world to a standstill in a global moment of reckoning. The noose of fear, injustice, greed, control, and pollution tightened around our collective necks. Whether we experienced respiratory distress from a viral infection, or felt suffocated behind a mask, or strangulated by injustice or overwhelmed by anxiety, we became acutely aware of our breathing and our fractured relationship with our most basic inner resource. The events of this year have also woken us up to everything that the breath represents: connection, relationality, the cycles of death and life, and our connection to all of nature. The pandemic is the invitation to return to our natural state. And whether it was through desperation or inspiration that the world is responding and seeking ways to breathe that brings calm and solace, that soothes pain, boosts immunity, optimizes health, and breaks down the barriers between us. Certainly, we have come back to our most basic human function. So what I'd really like to share with you today is why and how the art and science of conscious breathing has the potential to catalyze a revolution in healthcare, in education, and in our politics, to return basic agency to us as individuals, back to our greatest human capacity for compassion and creativity and connection. The breath is a bridge between an embodied experience, science, our history, our ancestry, and our story as humanity. So perhaps a place to begin would be with my personal story of the breath. It was in 1995, Baragwanath Hospital, Soweto. A young medical student with a crisp white lab coat and red stethoscope And I was gathering signs: pyrexia, tick; enlarged lymph nodes, tick; weight loss, oral thrush. I just had one more sign to check before I clinched the diagnosis. I asked her to lean forward and placed the cold round disc of my newly acquired stethoscope on her skin, just where the hospital gown revealed her skin and skeletal frame. Deep breath, I said. Hema. I must have mechanically gone through that routine thousands of times throughout my med school years and as a young GP, listening out for wheezes, crepitations, and signs of respiratory pathology. Never could I have imagined then that my relationship with breath would lead me on a long journey, far away from Western medicine, and then back to it again, this time in a way that understands that this disregarded function of life as the key to physical health, emotional regulation, resilience, and spiritual connection. A way to heal trauma and the deeply buried wounds of our past. A way to restore our connection to nature. Over the last 10 years, as I have explored biomechanics, dynamics, and the chemistry of breathing, I have deepened my understanding of the body-mind connection. Through the lens of the breath, I have become really inspired by the potential of conscious breathing to become a fundamental aspect of preventative medicine and a therapeutic intervention. So it has been estimated that 90% of the general population has dysfunctional breathing patterns created as a result of chronic stress, past trauma, poor diet, postural tension patterns, and environmental pollution. And in turn, many of the most common symptoms related to ill health can be related back to dysfunctional breathing habits. So our unconscious breathing habits reflect our patterns of thinking, our feelings, our emotions, our behavior, and our posture. So this creates an obvious connection between our breath and health beyond the realm of respiratory illness. If one is committed to practicing a system of health that addresses the root causes of disease, one cannot ignore the relationship we have with our own breath. So each day in my practice, I notice the irregular and suboptimal patterns of breathing in patients with chronic anxiety, depression, insomnia, irritable bowel syndrome, sinusitis, autoimmune conditions. And by restoring some basic parameters of breathing, we can see the very measurable and subjective improvement in the symptoms, but more than that, a restoration of hope. We see an improvement in sleep, in levels of anxiety, of mood, in pain. And the results that I have seen in my practice have been substantiated by thousands of studies that are now being done in the field of breathwork. Within our current global context, and particularly in the South African context, where we have so much historical trauma, hunger, poverty, violence, means that the majority of our population lives in a state of hypervigilance and chronic stress. And typically, sympathetic overdrive is reflected in some typical breathing habits. These include habitual mouth breathing and dysfunction of our main breathing muscle, which is the diaphragm, which then leads to the overuse of our accessory muscles in the neck and the shoulders. So an overactivated stress response and high levels of circulating stress hormones like adrenaline and cortisol, inflammation, and compromised immune systems are all exacerbated by our failing health system and adds to the burden of acute and chronic illness. And all of these factors, these existing factors, have been highlighted by the pandemic, which is now having a devastating effect on our mental health. High rates of anxiety, depression, domestic violence, and suicide have surged and will no doubt continue to rise into the new year. Consciously changing the way we breathe and restoring optimal breathing offers us a direct and measurable and sustainable access to our autonomic nervous system. There is a place to apply conscious breathing as a therapeutic health intervention, but also to empower every person to establish a relationship with their breathing to support sustainable wellness. The field of contemporary breathwork is a rapidly expanding field of practice and research. By understanding the physiological basis of traditional practices, we are able to demystify, simplify, and teach them in a way that is accessible to more people. In some cases, a simple breath awareness practice can become a powerful entry point to create the shift. In other cases, a therapeutic intervention through a deeper experience of conscious connected breathing will free up the restricted breathing patterns and supports the release of emotional tension patterns and deeply held trauma that is not easily accessible with conventional therapy. So in the last few years, I have been working with the Art of Breathwork framework, and ART being the acronym for awareness, regulation, and transformation. And I've been using this as a way to simplify and apply the vast range of breathing practices, to apply them in all contexts, from schools to primary healthcare centers, clinics, hospitals, addiction centers, frail care homes, and prisons in a way that is empowering, effective, and sustainable. The practices that form part of the framework serve to regulate the nervous system, can dampen the activity of the amygdala, which activates the stress response, improves sleep, boosts the vagal nerve tone, and activates the activity of the parasympathetic nervous system. But before we apply the actual techniques, we spend some time just creating the fundamental basis of optimal breathing. And the first is simple breath awareness, waking people up to the natural breath, the fact that their breath is supporting their life, that their breath has always been with them. And by consciously turning towards the breath, it offers an awareness of thoughts, feelings, and a sense of embodiment. So we always begin with breath awareness. The second parameter that we reestablish is teaching people to breathe through their nose. Now, this may seem really obvious that we breathe through the nose, but in fact, it has been shown that about 50% of the general population will breathe chronically through their mouth. And this will exacerbate the stress response and may even trigger anxiety as a separate factor. By teaching people to breathe through their nose again, we're teaching them rather to regulate the stress response, to increase their heart rate variability, to increase their heart coherence, reduce blood pressure. And this seems to have a significant impact on levels of fatigue and improve sleep significantly. The third aspect of optimal breathing that we teach people is to release the diaphragm. The diaphragm being our main breathing muscle that separates the chest from the abdomen. And many of us, well, most of us, because of our posture, because of these chronic tension patterns that we hold, and just habits of breathing that we have developed over our lifetime, have a restricted diaphragm. As a result, we tend to breathe high up in the chest, which, as I mentioned earlier, tends to exacerbate and trigger the stress response. So once these basic pillars or parameters of optimal breathing are in place, then we can move on to the self-regulation techniques. So we have organized the range of breathing practices into three main categories: breathing for energy, breathing for relaxation, and breathing for balance. So the Wim Hof technique is just an example of an energizing practice that has become quite popular. So what we do is try and demystify the practice and explain the science behind it, so that when people are actually practicing it, they are understanding what is going on in their body-mind system, which is really empowering. So they're really understanding through the science when to apply these techniques, and so that they can integrate it in a very practical way in their everyday life. There are a range of breathing practices that support a state of relaxation. And so we teach the techniques like humming bee breath, which comes from a yoga practice. We also teach a popular technique that supports deeper sleep, like the 4-7-8, which is essentially breathing in for a count of 4, holding for a count of 7, and then exhaling for a count of 8. And so by teaching people that we can activate the relaxation response through the parasympathetic nervous system through specific practices that focus more on the exhalation, they can start to really understand how to use these techniques for themselves. So I've spoken about breathing for energy and breathing for relaxation. There are also a whole range of practices that support a state of balance between the sympathetic and parasympathetic nervous system. And probably the most well-known or most well-researched of these techniques is coherent breathing, which is essentially equalizing the time we spend on the inhale and the exhale. Breathing in for a count of 5 or 6 seconds and exhaling for a count of 5 or 6 seconds, all through the nose. And there's compelling research on coherent breathing that has been done by the Institute of HeartMath, and prominent psychiatrists, Dr. Richard Brown and Dr. Pat Gerbag, who have been teaching this technique specifically in the context of PTSD. Coherent breathing has been shown to increase a heart rate variability, which is the measure for resilience. To date, over 250 people have been through our training with Breathwork Africa and now are equipped to share these basic practices in the Art of Breathing framework. And over 60 advanced practitioners have been or are currently in training and are working on the ground in urban and rural schools, in the business environment, in the arts. And one of our certified practitioners, Dr. Kelly Gillespie from the University of the Western Cape, has been doing phenomenal work with the activist communities in Cape Town. We cannot afford to wait for a long-term solution to the socio-economic and health crisis that we are a part of. And perhaps a starting point for our most pressing problems has been here all along, right under our noses. Free, accessible, and always available in our conscious control. My hope is that we will not use the, my hope is that we will not lose the opportunity that has been offered by this year, that each of us will take responsibility for our own health and well-being, and will come back to the basics of what makes us human. Let's start to build from this place. It is my greatest desire that we will bring conscious breathing into our school curriculum and into our healthcare system, that the breath will take center stage in the restoration of our health and of our hearts, that as systems break and collapse, we are ready to build the bridges within us and between us, and armed with our most powerful inner resource, one day at a time, one breath at a time. So thank you for listening to me today. And I'd like to perhaps close off with a 5-minute breathing session. If you would like to breathe with me, just to experience a turning inwards, a waking up of this breath that has always been with you. Okay, so I invite you now just to sit back in your chair, wherever you are, to relax in a posture of presence, uncrossing your feet, placing your feet on the floor, allowing your hands just to rest where they feel comfortable. And with a soft sigh, relax the back of your neck and your shoulders. And simply become aware that you are breathing. Turn your attention towards the inhale and exhale. And right at the tip of your nose, just feel that place where air becomes breath. And follow this breath as it travels all the way down through your respiratory tract. And then back up again as you exhale. Just appreciating that this exhaled air, this exhaled breath, has traveled a long journey within you, has touched every single cell of your body, has gone through a biochemical alchemy within the mitochondria of every single cell. And this incredible exchange is happening with every breath, whether you're aware of it or not. This is a profound experience of the intelligent pulse of life. So relax within this rhythm now, just enjoying the experience of being breathed. No need to breathe in any way right now. Simply to enjoy the experience of the rise and fall of the inhale and exhale. To enjoy the rise and fall of your belly as you inhale and exhale. And perhaps by turning your attention to the breath, you're becoming aware of thoughts, emotions, or sensations. Allow that all to be there, returning back to the stillness that the breath brings, the soft rhythm of the breath in your belly, the feeling of home inside you. And very gently and slowly begin to slow down the inhale, taking your time to expand it, to slow it down, and then to feel into the moment that the inhale turns into the exhale, and then to enjoy the experience of letting the exhale go as you release tension and waiting for the next inhale to arrive. And co-creating with the breath now, as you consciously slow it down and invites more breath by expanding your rib cage. And just allow the exhale to drop out however it feels natural. Now simply breathe in a way that feels soothing, that feels calming. Now just let the breath rest, noticing what you're experiencing right now. And when you're ready, gently open your eyes if they are closed, and welcome back into the room. So thank you for sharing that with me today. And yeah, I would love to chat to you all, to answer any questions that you may have. Perhaps you can share your experience. So yeah, if there are any questions, you're welcome to unmute or pop them into the chat box.
Thank you very much, Dr. Manga, for this very interesting talk. And thank you very much for taking us through this wonderful breathing exercise. I'm now going to Carla, who's going to make a couple of comments. Carla?
Thank you. Thank you so much for bringing us after a week that I'm sure has been very many things to very many people to this point of reconnecting with ourselves, with our surroundings, and with this particular spot. It's an absolutely brilliant way to bring a keynote to its conclusion. So you fed both our lungs and our minds, and we thank you very much for that. As you were talking and as you were doing these exercises, the two things that kind of sat with me primarily were the overlaps between information and knowledge and the ideas of connections, both of which have been central to what's been coming up throughout the symposium to date. And in some ways your keynote is this perfect central point to what has been discussed over the last 2 weeks. I was particularly interested in that transition that you described in your personal experience, of that moment of having information about how somebody breathes, how to listen to that, how to measure a thing, and translating that into knowledge, into a different way of engaging with information that is more extended, more applicable, more analytical, and then also develops into a different consciousness in some ways. And it reflects in some ways on experiences we've had with teaching yoga to MBCHB students who spend, you know, much of their entire day dealing with every sort of component aspect of the body, and yet to learn to breathe, to actually be conscious of one's own body in a different way, is not something that's fundamentally spared into that space. The kind of links between information and knowledge have also, what you're talking about, have linked with some of the points that have been made in previous sessions. Firdous Mandusat spoke about trauma-related yoga, which you kind of referenced, not necessarily trauma-related yoga, but trauma-related breathing response or breathing for trauma, and spoke about her experiences with working with refugee groups and prison populations. And that tension of, as you say, that the capacity of the breath to transform and to allow a healing space becomes central. And yet those knowledge and information and teaching is also linked to a hierarchy of knowledge. And one of the questions that has come up repeatedly, and I really appreciate your insights on this, is how do we respectfully engage with multiple disciplines and knowledges and traditions and types of way of being in a way that ensures that things like pranayama, or for example, people who are schooled in specific trains of breath, are still respected, and that the processes aren't kind of just modern, like wrapped up and repackaged in a new kind of way. So how do we ensure balance in our practice, in our research, in our engagements of epistemic differences that are also respectful of the traditions from which they come? So that I'd be very interested in your comment on that. Would you like to take that now, or shall I go on?
Oh no, carry on. Carry on, Carl.
And then the other thing that's become, and I think it's been amazing in terms of the incredible overlap between what you've spoken about and what's come so far on the symposium, is the idea of connection. You know, the connections between breath is something that can connect us to ourselves and to others, but can also disconnect us in the case of COVID, where nobody wants to be breathing on each other. And some of our panelists in yesterday's and Wednesday's session spoke about, you know, the unwelcome breath, the breath that's associated with violence or trauma, when somebody else is breathing on you, and that shared breath is not something that one. And we had, you know, Anna's piece spoke about, you know, is the breath of connection that can be this incredible thing, and yet in the same time we're living through these moments of heightened racism, heightened GBV. So there's, you know, people can't breathe because of these contractions. So I suppose my question to you then, oh yeah, and the positive connections of breath have come through this week as well, with singing and dancing, and how to use things like singing and dancing for breathlessness, and how the impact that those kind of experiences have had in terms of addressing things like COVID in the field hospitals that were set up. So I suppose the other thing I'd be very interested to hear from you is, how do we balance those kind of connections and disconnections? So the disconnection of burnout with the kind of realities of things burning down around us, or being burnt down, often because they kind of have to be, because this is also a time when the planetary crisis is such that there needs to be response. So that burnout and burning down, and also the space between the resilience that you spoke about in terms of what breath can allow, and the need for resistance to structures of oppression that surround us. So yes, I just wondered if you could comment on those for us, please. Thank you.
Wow, thanks, Carla. Those are big questions.
And I know in a short space.
Okay, I'm going to start with the question that you asked around the traditional practices, and then also making breath more available. And so this is a really interesting one. Oh, I don't know. Sorry, you just disappeared there for a second. Sorry, I'm back.
We can see you.
Oh, okay, good. I was just wondering what happened there. The screen just
went did it go that white blank. Screen? Yes, it's weird. I have no idea why.
Okay. You know, I don't think there's an easy answer to this, Carla. I think, you know, so one of the assignments that we give our advanced practitioners is to find the reference of breath in the sacred texts and the reference to breath from the traditional wisdom practices. And it's really fascinating that we can find reference to the breath in every single sacred text and tradition, from shamanic practices to the indigenous wisdom practices of Africa. It's made reference to in every tradition. And so it's to honor that. It's to honor the beauty and the wisdom and the essence that lies within each of these practices. But at the same time, those practices that find their home in these traditions can also be alienating to others who could get the benefit from them. And so with the Art of Breathing framework, our aim is to simplify these practices and for the purposes of breath being a supportive tool, an empowering tool. You know, we run the risk of diluting them, I suppose, but perhaps not diluting, but rather simplifying them, but at the same time honoring their roots. So, for example, when we teach humming-bee breath, which comes from a yoga practice, it's a beautiful pranayama practice, and yet, you know, when we study the science of it, we can't not share it because of the powerful benefits. We know that it increases the levels of nitric oxide in the paranasal cavities. You know, that this is a powerful antimicrobial, that it powerfully boosts the vagus nerve, that, you know, there are measurable benefits of this practice. So I think it's to honor both. It's to honor the essence and the root of these traditional practices, but then also to strip away anything that may make them alienating. Okay,
okay, we have 4 questions for you. So I'll take 2 at a time. I'll first take Neil. Would you like to ask Dr. Manga your question? And then Susan. Neil, would you like to start?
Sorry about that. I was clicking the wrong icon. I was just interested to learn a little bit more about the way your fellows in the medical profession have, you know, what has their attitude been to your approach around breath? Has there been support, resistance? And if there has been resistance, how have you countered that? Yeah, and thank you very much. I enjoyed it.
Thank you so much, Neil. So yes, it's interesting because I kind of moved away from conventional medicine about 15 years ago. And I've been practicing in an integrative model for the last 15 years. And I suppose then the response or the reaction I got from my colleagues was very different to the response that I'm getting now. And in fact, I'm working very closely with a cardiologist, Dr. Riaz Motara. We share rooms, we share the same space. And he has been referring many of his patients to me because he's had a personal experience of it and he's found personal benefit from it, but also he's seeing the impact of conscious breathing in his patients. And so he has a device where he's actually measuring heart rate variability and the levels of sympathetic overdrive. So there's actually a measurable impact in this approach. And I think just through this year and the experience of this year and the pandemic, you know, so many doctors are feeling, I suppose, they're looking for tools to support their patients more. So there's far more openness in the field now, and that has also been helped by the research that is coming out in the field. So there's a lot more openness that I am experiencing now from colleagues. And in fact, many doctors have started to come into our courses, which is very exciting.
Okay, thanks very much.
Good.
Susan, would you like to ask your question?
Yes, hi Nawazi, hi Carla. Thank you so much, Dr. Manga, and hi everyone, it's nice to see you. I'm going to take my academic hat off. I'm the head of the anthropology department at UCT. I'm an hour and a half out of anesthesia, which is why I'm in bed. I'm going to really talk personally now because your talk touched something very deep. And I've been so busy teaching over the last 2 weeks, literally hours and hours every day, and managing student crises and staff crises, that I haven't been able to attend much of the previous 2-week sessions, except for just like, glimpsing in. So I know that this keynote comes at the sort of, after a period of robust contemplation, around breath. But yeah, it's something that yeah, so I'm actually crying. That was really touching what you said about COVID and the stresses. For the past 4 months, I've been unbelievably nauseous and vomiting and having deep sickness, which was diagnosed as a stress-related gastro problem due to just the, working online, working in these times of absolute precarity with zero institutional support for those of us who don't have weekends, don't have time off, don't have a distinction between night and day. And when the medication didn't work, they said, you really better go in for a colonoscopy and a gastroscopy. And so I'm very happy to report that I did that now. I've just come out of the hospital and I don't have cancer, thank God. So that was proven away, but that was a worry of my GP, actually, that there was some kind of ulcerous, ulcer stress-induced that had gone wrong. But I do have an incredibly inflamed gut, to the point where I've now have to be booked off of work for some time. And I'm just curious, I guess here's my question. Okay, so what you've said about COVID and the stress and the need for, breath work and reconnecting with a way, it feels as if this critical intervention around reconnecting with our breath and being able to become resilient people somehow puts the responsibility back on us as individuals to find a way to survive, to find a way to breathe through the deep inequities of our world, of institutions. And I'm curious about the politics of placing that responsibility of well-being and finding ways through, not just this pandemic, but through life in general. What the politics of that are, and if you've had any thoughts about that, and the ways in which this critical intervention and breathwork, which you say, Kelly Gillespie's been using it in activist contexts, in prisons, in such important modes, could somehow feed back into institutional frameworks like WITS, where our colleagues are, UWC or UCT, that it could actually say, we've gotten to the point now where we need to reteach people how to breathe. Rather than thinking about the ways in which institutions could make them breathable, or the ways in which we could maybe, as all of us know, if we do take a month off and we spend time at the beach or just not working, we tend to exhale in a much different way. So it's a question of the violence of our institutions that don't recognize the significance of breath, and I've never had health issues like this in my life. I'm also getting older, but it's acute. So I just wanted to say, your talk could not have come at the most perfect hour. I really took everything in that you said. Thank you to the organizers, Carla and Nawazi. And so I'm just interested in your feedback.
Oh, thank you, Susan. Thank you for sharing your experience. That's very touching for me too. Sure, so your question speaks to a personal process that I've had to go through in my own journey as a medical doctor, and shifting the paradigm of medicine from one that places power in the hands of the doctor, the institution, the medicine, to one that supports a partnership between the doctor and the patient. And so I'm speaking about this in terms of healthcare, but I think this relates to every organization. And, you know, I think we have been conditioned into a way of thinking that takes away our agency, but that also places power in the hands of institutions. So I believe a starting point is to come back to the power that resides within our own being, through our own breath. And perhaps it doesn't change our experience, or it doesn't change the circumstances in which we find ourselves, but it certainly can change the way that we are relating to it.
Yeah.
I mean, it's not a straightforward answer, this. I mean,
yeah, it's a question of the relationship between, yeah, and you've helped, thank you. But you've also opened a window for me to think about ways of engaging with the institution on that level, because the institutions also need to take a breath.
Right. Yeah, we perpetuate these systems, you know, we are all part of it, and we are complicit in perpetuating it because we just feed into the same pattern, the same dynamic. So, you know, what I love about the breath, that it is a tool of relationality. And so it reestablishes a sense of relationality between these disconnected aspects of who we are, but also it is a relational tool between each other. It is a way to connect to each other that is beyond our pain, that's from a place that is untouched by our trauma. And that is the place that we all share. And perhaps if we can start to have conversations from this place, it is an opportunity to start to heal, to build up from what is broken, and to allow the breaking, the dying of what no longer serves us, rather than trying to piece together these broken, fractured fragments.
That's really helpful. Thank you so much. Really.
Thank you, Susan.
I look forward to maybe emailing you.
Thank you. Thank you. Please
Thanks.
do.
Thanks.
Goliswa, would you like to ask your question?
Hi. So I think this actually leads off nicely from the last conversation, in that, you know, my question is around, you know, we have to wear masks. We go to the office, we go to meetings, and obviously our breath is compromised in that way. So my question is, like, what kind of exercises could one do, possibly throughout the day or whenever, you know, in such a situation, just to maintain that coherent breathing?
Right. Okay. Yes, thank you for your question. So yeah, the breathing with the masks really has been quite an interesting aspect to this whole COVID experience. And, you know, it really comes down to the fact that the mask has highlighted the fact that we are breathing suboptimally. And so in order to breathe most effectively, to make the best use of every breath, it is necessary for us to train ourselves to breathe through the nose. Now, immediately when we put the mask on, we tend to breathe through our mouth, okay, which is it's a stress response in reaction to feeling suffocated by something over us. So it's not the impact of the mask on breathing in itself, but rather the psychological and emotional impacts that feeling suffocated has. Okay, so that's just one aspect of it. How do we start to restore this? And it's what I was saying right at the beginning of my talk, is coming back to those basic pillars of breathing: breath awareness, training ourselves to breathe slowly through the nose and then using our diaphragm more. So learning to breathe deep and low from the belly rather than using the neck and the shoulder muscles, which would be an instinctive and reactive pattern to breathing with a mask. And then also just to be more conscious of more open, free breaths when we don't have the mask. So really the breathing with a mask is an opportunity to re-establish some basic parameters of breathing. I hope that answers your question.
Oh, yes, thank you. Sorry, I had to unmute. Thank you. Goodbye.
Okay, great.
Next is Dee. Dee, would you like to ask your question?
Sure. Trying to, sorry, technically challenged. Sure, I must say everything you've been saying, Ella, resonates so much. I've had a day of shocking sinusitis and headaches, and when you started doing that exercise with us, I could actually just feel everything releasing. So it really was quite astounding. And just the comment that you've just made now about how I've actually found myself when I spend a day with a mask on, by the end of the day, I've almost got this like sort of rictus type grimace on my face underneath my mask where my jaw is in pain. So, and it just does become so unconscious. So yeah, to go back to that sort of conscious approach. What I was really wanting to ask you was, I work a lot with children who have experienced trauma or just through being defined as atypical and possibly on the autism spectrum, they literally live a life of trauma. I mean, the interesting thing is, on the one hand, children who've been through abuse or neglect or exploitation, but on the other hand, children who just experience their world as abusive because of sensory sensitivity and so on. So they spend their sort of entire life sitting in this fight or flight mode. And the only time I've really seen them kind of get out of that mode is in sensory rooms or sensory gardens and that sort of space. And of course, the idea of, I mean, I really resonate with this whole issue of institutions. I work a lot with child protection institutions, and this is the kind of stuff that they will not prioritize. Well, they certainly don't prioritize. And the minute you try and change systems and approaches, there's this massive rejection because supposedly what they're doing works, which of course it doesn't. But so breath is just so accessible. We can all breathe. And I just wondered if maybe you could share a story where, I just need to understand, what would it look like if you had to work with a child, for instance, who's sitting in this, or an adult in this sort of real fight or flight mode, how you traverse them into this kind of rest and digest space through breath. And I thought maybe you could just share a story of that kind of experience with us.
Yes, beautiful. Yeah, it's a pity my colleague Marge Murray had to leave because she works specifically with children.
Okay.
Yeah, I think children are in general quite embodied beings. And so I think the first thing is to bring them back to their bodies and to reestablish a feeling of safety within their own bodies. And so I would work with a combination of movement and breath. Okay. Now, in this particular situation where you're working with the children with autism and, who are hypersensitive sensorily, then I would work with hummingbee breath, for example, which is really, it's fantastic to shut off the overwhelm of sensory inputs coming in from, so I don't know if you're familiar with hummingbee breath, but essentially it's just a long hum. So it's a long inhale through the nose, and then we're actually closing off the ears with a flap, with the thumbs, and placing the fingers gently over the eyes. And the pressure over the eyes stimulates what we call the oculocardiac reflex, which boosts the vagal tone. And the long hum is also a profound way to activate the vagus nerve, which immediately kind of activates the parasympathetic nervous system. Okay. And that's quite easy, and it's fun. So yeah, that's just we've had some great feedback from hummingbee breath with children and adults. Actually, it's the one technique that I've taught the most this year
Wonderful. Thanks so much. And thanks for such an amazing talk. I really loved it.
Thank you, Dee.
I'm aware of the time and we're fast approaching 4 o'clock. So Benson, I'll ask you if you want to ask your question, or would you rather email Dr. Manga? Are you there, Benson? Okay, I'll take that as a no. I'd like to thank you very much, Dr. Manga, for this really interesting and inspiring talk. And Carla, actually, for your comments, and to the audience for their question and for being here. By way of ending off, I'd like Carla to talk a little bit more about what we have in the next 2 weeks, what the program looks like.
Thank you. Thank you very much, Nwazi, for your chairing, Ela, for your amazing input, and to all of you. And I'd also just like to acknowledge Benson, who's replied that he will email, who is also one of our regional committee members. And so it's very lovely. We've had technical hitches with the committee members getting on, so it's really exciting when we can actually get into a space together. For those of you who've not yet had a chance to have a look at the websites or the creative work that's been up, please do go and have a look. There have been some beautifully synergistic overlaps in terms of discussions and questions and comments, and I'm very pleased to see many of you back in this room who've been in other sessions, so thank you also for kind of getting the sense of the symposium as it unfolds. I'd love to claim that Nwazi and I were really brilliant at organizing this. The keynote would work so beautifully with the other week, but in fact it has nothing to do with us, so we'd love to thank all the participants and everybody in the team for helping us get this far into the process. So just to keep you excited about what's coming up next, okay. Next week's themes are around breath and breathing. I said this week we've had a lot of discussion about singing and dancing and breath and breathlessness, which built on from the first week, which was around the kind of often inhaling or exhaling or holding of breath in the context of the times. And so this moment now is a space where it feels like all those kind of ideas have come together so beautifully. Next week's creative works speak to a number of issues. There's a piece by Althea de Reiters that is a sort of analysis of being a young woman at this particular moment in South Africa, and it works quite nicely with Gabrielle Carolus' Ho Yo Beck, which was about GBV at this point of time in South Africa. So those two pieces quite nicely overlap. Malaika and Lovu has created a piece specifically for the symposium, which we'd like you to invite to have a look at next week. And then we also have photography by Neil Overy that looks particularly at the ideas of inhaling that which is dangerous if you live near a nuclear power station, as some of us do in this neck of the country. So those themes speak particularly to the ideas of breath in our environment and us in the environment of breath. And our panels do similar things. So we have people talking about environmental health related psychological distress, young people managing infectious diseases, breathing in dust underground. So the constant, I mean, as long as there have been mines in anywhere on this continent, there have been breathing issues related to the process of mining. So we have a group of people coming together to talk around, I suppose, gasping essentially for breath. We also have 2 workshops, music and digital storytelling. And for those who were at the very first workshop, we learned a number of the breathing techniques that Ela spoke about have come up. So it's been an exciting space. If you haven't done them, the recordings will be up. If not, now is your time to have a look at Ela's website, have a look at other places and see how wildly, fabulously you can hum. So we have a workshop on music and digital storytelling, and we also have one on kind of mindfulness and breathing. And additional creative works that link some of these issues that Ela, you opened your talk with. So California Burning is a piece by Marissa Micah about exact the situation of literally half the planet in many cases being alight at this very point and what that means about air. So we also have inputs around mental health and COVID. and a series of paintings by a Malawian artist, Nixon Malamolo. So we would really like to invite you to join us next week and the week after. And in our final week, there will be the second of our keynote addresses by Jane McNaughton, who is the director for the Institute of Medical Humanities at Durham University, called The Breath of Degradation, Why is Breathlessness Invisible? And so we're hoping that will also allow us a lovely coming together of these exhaled moments of inspiration and exploration to all of us. So thank you so much. Thank you everyone for being here. Thank you again to everybody behind the scenes who make these things possible, who keep the registration, Charlotte, Zine, Claire, Sash, all of you at the back end who are making all of this possible. And to all of you for doing this on your Friday afternoon. What an incredible way to end the week. Thank you again very much, Ela. Much appreciated.
Thank you, everyone.